Nausea and vomiting are the most common side effects that are reported in your clinics, and there might be reason that they're due to any sort of use of medication, and there might be other reasons to it as well. So if the patient comes to you with this problem, you need to ask them certain questions that are related to the diagnosis of this cause of this nausea and vomiting. So you need to ask either they have fever, weight loss, headache, earache, sore throat, blood and vomit, or either they are vomiting blood, abdominal swelling or pain, diarrhea, decrease in bowel movements, crying on urination, dark urine, weakness, dizziness when standing, skin bruising, red spots on skin, yellowing skin, or blood in stool. You also need to take their family history, specifically child's family history, that either they have any blood vessel problems in the esophagus, any ulcer disease, gastritis, liver disease, bleeding disorders, or any gastrointestinal bleedings. You also need to ask that the child has been throwing up and how much is the amount of that throwing up. You also need to ask the parents of the child that either the child was exposed to the people that were suffering from any nausea, vomiting, or either they had any liver disease such as hepatitis. And if the child is vomiting blood, then you might want to know that how many times this has occurred and how much blood the child is throwing up, and whether the blood appears bright red or darker brown in color. Okay, so after that you need to take a medication history that either the child has been taking any aspirin, endomethacin, or any steroids. So after taking all the history, you need to move towards the physical examination. And the physical examination include checking of pulse, weight, height, thorough eye exam, checking the neck for stiffness, looking in the throat, and pushing on the abdomen, and checking stool for the presence of blood, and lastly thorough skin exam, and other tests can also be performed. So what can cause nausea and vomiting in children, and what could be the typical symptom for each? Let's find out right now. So if the child has often nausea and vomiting, and it is relieved by frequent burping or changing feeding schedules, and it usually occurs more commonly in premature infants, then there's a chance that they have gastroesophageal reflux. It is the movement of stomach acid up into and through the esophagus, which connects the throat to the stomach. So if the patient has diarrhea, abdominal pain, muscle aches, and mild fever, then they might have acute gastroenteritis, which is the infection of the stomach. Well, if the child has fever, severe vomiting along with diarrhea, then there's a chance that they might have a systemic infection, which is a body-wide infection, perhaps resulting from any ear infection, tonsillitis, or kidney infection. Well, if the patient has diarrhea, abdominal pain, muscle aches, mild fever, light stools, dark urine, yellowing skin, occurs after contact with people that are infected with hepatitis, then the child may be suffering from hepatitis, which is a liver infection. So, if the patient has persistent vomiting, a large amount of food in vomit, and they also may vomit blood, they also are suffering from weight loss, and it usually occurs in the first 3 months of life, which means a baby infant is having all these symptoms, then there's a high chance that they have high bowel obstruction, which is blockage in the upper bowel. And if the patient has green bile and vomit, decrease or lack of bowel movements, and it occurs in children younger than 2 years, then they might have lower bowel obstruction, which is the blockage in the lower bowel. So if the patient has problems in head holding, and they might have headache, tiredness, and they also are presented with projectile vomiting, then there's a high chance that the child has the brain injury that occurs as a result of inflammation, tumor, or any sort of injury in the brain. If the child shows behavioral changes which is followed by unconsciousness, then there might be a chance that any poison or medication has been taken by the child, which is ingestion of poison or too much of a medication. So you also need to look out for this one as well. Well, if the patient has vomiting soon after birth or vomiting after trying a food for the first time and is followed by frequent weight loss, then there's a chance that they might have metabolic disease, and it is a disease affecting the way of food and other substances that are broken down. Well, if the child has nausea and vomiting but is otherwise normal, then there might be any psychological disturbance involved, in which vomiting following fright or excitement or in order to get attention. Well, if the child has history of long bouts of retching before vomiting blood, then there's a high chance that they might have an esophageal tear. It is a tear in the tissue of the tube that connects the back of the throat to the stomach. Lastly, if the patient has family history of bleeding easily or excessively, then there's a high chance that the child has any bleeding disorder, which is problem with bleeding such as trouble clotting. So that was all about the nausea and vomiting related differential diagnosis, and specifically in children. Hope you've learned something new today, and for more differential diagnosis videos, keep following sqadia.com.